Welcome to the summer workshop of the Roundtable on Population Health Improvement. I'm Kirsten Bibbins-Domingo. I'm the Vice Dean for Population Health and Health Equity at the University of California, San Francisco School of Medicine, and I have the pleasure of serving as one of the co-chairs of the Roundtable on Population Health Improvement, housed within the Health and Medicine Division of the National Academies of Sciences, Engineering, and Medicine. I welcome our virtual audience today and those who are viewing the recorded webcast of the workshop titled Civic Engagement and Civic Infrastructure to Advance Health Equity. Although this will be a virtual workshop, it is being hosted from a physical location in Washington, D.C., the home of the National Academies and the Roundtable. For that reason, I would like to acknowledge and offer our deep gratitude and respect to the Nacotchtank Piscataway people and elders and ancestors, past, present, and future. Everywhere in the United States,
recording in progress,
speakers and attendees find themselves at this moment, we are on the lands of Native American tribes and peoples. We lift up all of the ancestors who have struggled for justice. In their memory, we seek to help build a just future by centering health equity as the prerequisite to improving population health. Our roundtable recognizes that health and quality of life for all are shaped by interdependent historical and contemporary social, political, economic, environmental, genetic, behavioral, and healthcare factors. Therefore, the roundtable seeks to provoke and catalyze urgently needed multi-sector, community-engaged collaborative action. One way we aim to do this is by hosting several public workshops each year that bring together different perspectives, disciplines, and sectors to explore and share what works to improve the conditions for equitable health and well-being in U.S. communities. A few words about the rationale for this workshop. The topic of civic engagement is not new, either for the Roundtable or for the National Academies. Committees of the National Academies have examined civic engagement and social cohesion, advised the nation on what matters related to the census and securing the vote, and recommended including voter participation among the leading health indicators in Healthy People 2030. The Roundtable has showcased numerous examples of civic engagement, including faith-based efforts, such as community organizing work of Isaiah in the Twin Cities, or the Medicaid expansion campaign led by the Greater Cleveland congregations. Community organizations that partner with others to target living conditions that hamper and harm health around the country, from Beyond Housing in Missouri to the Tenderloin Health Improvement Project in San Francisco. And community-driven efforts to co-create and steward inclusive, healthy places in partnership with public and private sector partners, from Detroit's Fitzgerald Revitalization Project to Omaha's Highlander Village. Today's workshop was organized by a planning committee chaired by Roundtable member Sherry Johnson, and including Erica Blacksher, Daniel Dawes, Bruce Link, Phyllis Meadows, Karthik Ramakrishnan, and Itzhak Yanovitsky. The planning committee was supported by our Roundtable staff, Alina Bachu, Harika Dyer, Aisha Coltrane, and Ali Andrada. I will now invite Sherry Johnson to give you an overview of our two-day workshop. Sherry directs the Population Health Institute at the University of Wisconsin-Madison School of Medicine and Public Health, and she is also co-director of the County Health Rankings and Roadmaps.
Thank you, Dr. Bibbins-Domingo. In 2013, 10 months after its launch, the Roundtable on Population Health Improvement held a workshop titled Supporting a Movement for Health and Health Equity, Lessons from Social Movements. That workshop discussed lessons that could be gleaned from the labor, environmental, and other movements to inform those working to effect changes in the social, economic, and environmental conditions that contribute to Americans' shorter lives, poorer health, and profound health disparities, even from one zip code to another in the same county or metro area. That workshop began an arc that has continued through several of the Roundtable's events. Most recently, the workshop, Community-Led Initiatives to Improve Population Health, which was a workshop showcasing the scholarship and practice of recognizing and building the power of community members, as well as nurturing leadership and capacity. We are continuing today with the conversation about civic engagement in health. Many definitions of civic engagement exist. According to the National Conference on Citizenship, civic engagement reflects the degree to which citizens participate in their communities, from local and state governance to interactions with friends or family. Civic health also relates to the overall well-being of neighborhoods, communities, states, and the nation. They describe civic engagement as the act of working with local institutions and fellow residents to promote meaningful actions, movements, and relationships within a community or population. Most definitions also describe a broad range of structures, practices, and activities that characterize how people, as individuals and groups, are involved in imagining what they want, identifying problems to solve, and joining together to implement solutions. Familiar constructs include voting and attending public meetings, and memberships in groups that emerged in the context of systemic exclusion, such as Black Greek lettered organizations and the National Council of Negro Women, also represent powerful forms of civic engagement. Research indicates that health and civic engagement, whether voting or participating in any range of civic organizations, have a bidirectional relationship. Civic engagement, like affordable housing, a living wage, and a good education, is a social driver of health status, which has effects both on the health of those who are civically engaged and on the well-being of society as a whole. In other words, the health of members of a democratic society and the health of the democracy are intertwined. Our agenda for the next 2 days is organized into 5 major sessions. We begin with a context-setting conversation, then progress to an exploration of qualitative and quantitative measures of health and measures of civic engagement and the links between them. Following that discussion, we will learn from 2 youth commissioners working in Gonzales, California, to advance civic engagement and community health. Since many different components of the civic infrastructure exist in the United States, a panel of scholars and practitioners will then discuss the current state and future of our civic infrastructure. On Tuesday, we begin with the role of narrative and media in shaping civic engagement, and we end the workshop with a mini deliberative exercise that will allow workshop attendees to interact and put in practice some of what we have learned. If you are tweeting today, please follow at NASEM_health and follow the conversation by using the hashtag PopHealthRT. So now we're ready to begin our fireside chat. And as we begin the next session, please scroll to the Q&A below the webcast window and click on polls to answer a simple polling question. We will return to the results of that poll tomorrow.